Hello and welcome to another in our new series of the community conversations, where the idea is to have an informal chat with different groups around the UK, actually worldwide, really, that are actively in their community and are supporting people in whatever capacity, whether that be health, food, education, or something else, just to see what they're doing, how they've gone about doing it, and the challenges that they faced along the way. So it hopefully will help inspire others who are on their journey to see what can be done, and doesn't have to be an all singing, all dancing finished product immediately. But there are some wonderful things going on, and it really is about sharing that. So with that in mind, I'd love to welcome the team from Your Good Health in York. And whoever would like to start, please do jump in with what it is that you've actually been doing, because I know there's been some brilliant stuff going on in the last, what is it, 18 months now? 2 years?
3 years.
3 years, goodness me.
Sue and I were
Um,
there right at the very beginning, so I'll just leap in because we can just do a little bit of history. We don't want to dwell too much on the history, but before People's Health Alliance even existed, we were talking about the need for this. It's an idea whose time has come for sure, and it was floating around in various different groups online when we started having lockdowns and whatnot. So we met in the previous incarnation of our clinic, Wellbeing in New York, and then we started going into town and meeting in more central locations in a cafe, and we gathered more people, and basically we wrote to people that we know, didn't we?
Yeah.
Who would have been sympathetic, people who were awake and aware and wanting to help and support. And mainly they were practitioners of complementary alternative, integrative healthcare. But we were also reaching out to medical professionals as well, because we wanted it to be a full spectrum thing, not just another complementary health clinic. That was really important from the beginning, wasn't it?
We were looking for a venue because obviously meeting online is, it's about meeting, in person as well. I had suggested, we met a couple of places, more commercial places, and I said, well, what about scout huts? And I think that was taken with a bit of a joke. What do you mean scout huts? There's loads of scout huts. They're very, available. And everybody usually knows where scout huts is. They don't have a child at the scout thing. They know of somebody, or they know the scout leader. And I know scout leaders here and there. And that's, but it was taken with a bit of a pinch of salt. Scout hut. What would you want to live in a scout hut?
Well, it was me, because I heard her say hut, and I went, I don't want to go in a hut.
No,
I want to be in a proper building. And then I began to realize, I brought up my kids in York, but they weren't involved in scouts. They were woodcraft folk, because I've been alternative my whole life. So I didn't know about scout huts. So yeah. So anyway, we hammered out a bunch of documents, because we had loads of documents from our clinic that we could, adapt and use, like policy documents. So we're really happy to share those with anybody. And certainly we don't think they're the only way to do it, but they're the way we've done it. And they're constantly being revised and updated, like membership forms and service provider forms, to make sure everybody is aware of the kind of basic rules of the place.
And we knew we'd have to pay rent of some kind, even if it was like not in kind, but some sort of monetary involvement. And that's the other thing about scout huts. They don't charge the earth. Even back rooms in pubs charge a lot of, there used to be free rooms in pubs, but they're not anymore. And you'd have to pay by the hour. If you went over the hour, you'd have to pay. So I knew that scout huts wouldn't necessarily charge a lot in rent. They'd want something, and even if they wanted a deal sort of thing, they wouldn't charge us. And because they already used the place, that there'd be people coming in and out of it, and they would know, and it was word of mouth, a lot of it.
Yeah, so this cafe let us go there and meet for free, as long as we bought cups of tea and coffee and had snacks. So that was really nice. And then Lynn Peacock, my friend Lynn, who I've known for a long time, she's not a practitioner, but she's a carer. She's actually a she does oh my gosh,
adoption and
what's the word? No, it's caring for kids. Foster caring.
Foster
Thank
care,
you.
that's
That's
it,
the
not
word.
adoption, but yeah, of course.
Yeah. So, but she found this scout hut in her neighborhood, and I thought, well, great, that's really handy for me because it wasn't far from my house, and so I was beetling down there every Friday, to sit in this moldy and damp place because it had a lovely garden, and we thought, oh, it'll be all right in the summer, it'll be fine, but it was okay. It's okay, but that was one of the main drawbacks. And it didn't have parking, although I think the thing is we wanted to be in a place where people could just walk to it. We don't want to have a hub that people have to drive to. There should be something in every neighborhood. And we did think, didn't we, about having one in all sorts of areas. We thought, well, we'll start with one. We'll see how that goes. So now we've had to draw back from there because we just couldn't stay another winter. We committed to a whole year, so we had to see it out. And it was fairly cheap, and we raised the money. I mean, thankfully, at that point, the PHA was offering a bit of help and support, which really made a difference. And we had other lovely people who loaned us money, who still need that back, which we're very aware of, but we're not stopping. We've just had a tactical retreat. And then we had membership subs. We kept it deliberately very low, and we're now rethinking that one and asking people for more. And we've got a sponsorship form as well. And there are people lurking who are saying they're going to do fundraising and sponsoring things. But things take time. York is one of those places. I think everyone here will agree that
Absolutely.
sometimes it's like wading through treacle to get things to happen. It's takes its own time, and we have to be patient.
Yeah.
That's what
I think it's that, yeah, I think you bring up a really good point there, because skill sets as well, different people have different skill sets, and it's not just about practitioners actually, is it, that you need a whole range of people. So how did you kind of get together? How did you form the team that you currently got and the people that have been working with you? Was there anything that you found? I don't know who wants to answer this, whether Louise, I know you've been there from the start as well. How did you find each other, and sort of what drew you together to kind of create this vision for what you wanted in York?
I mean, I was introduced to it through a mutual friend. I think there's quite a network of spiritually minded folk in York. And so I was introduced via a friend, and then you show up every week and those relationships naturally build. And then you find out what skills people have. So myself, I was an accountant for 20 years. So straight away, I was volunteered as treasurer. I'm also a holistic practitioner as well. So I'm a hypnotherapist. So I come along and I do meditations for people. So yeah. And how many years has it been now? 3 years?
We started in 21. Yeah, and then mostly it was, I think you joined us in 22 after we got to the scout hut, not to the scout hut, to the cafe, the reading cafe. So we didn't meet every week during that first year. It was very here and there, spasmodic. Yes,
we meet by text and Zoom and things like that, and so other people came along, but they needed to know about it, but we didn't want to make sure that they didn't have to come every week, but as long as there was maybe 3-4 people there. And it wasn't, I mean, I've known June for 30 years or something. So.
Yeah, so some of it's kind of through networks that you already have, as well as then new people coming in and also sharing the same vision, because it's quite important, I think, and certainly the groups that I've been speaking to, in that having the shared vision is really important in terms of commitment, because you might get people that are really, really excited about what you're doing, but unless there's that commitment and that constant stream of people wanting to be involved in something, it's very difficult. And I know one of the biggest challenges is having that dedicated team of people that are there regularly to help push things forward. But you've obviously managed to do that. Leah, have you got any kind of thoughts, because have you come into this sort of slightly later down the road, and
Yeah, I
what was-
did. Well, I've known Jen for a long time and always been interested in what she does, because I mean, I agree with her. The vision bit, I think, is where there was never a problem, and Lou was on board too, so I'd pop in whenever I could. I mean, I think from my perspective, you know, I'm quite open-minded. I mean, that's another thing, is I think you have to have people being open to listening, because, you know, like, they've got different specialisms, and, you know, and I'm always thinking, oh, I'll try that out and listen to this. Oh, I didn't know that. You know, I mean, I guess being a bit curious and trying out different things is important. Well, I think I probably brought to it was the food element. So, you know, I've kind of like cooking. My mother was Greek, and then I've taken a few, you know, courses and stuff on nutrition over the years. So sit down and did quite a lot of research around the Mediterranean diet, and, you know, basically kind of like clean eating. So we had quite a lot of people where we got people coming in from different, you know, like how to grow and all that kind of seemed to bring a lot of interest. But
And
I
the
think,
exercise classes, you did some
yeah, I
really
did that too.
good
Yeah, because
exercise classes.
I, you know, previously, you know, used to do circuit training, and I thought movement would be good, you know, and almost anybody can move, even if, you know, not to the same degree, but obviously I knew what to ask and all that kind of thing. So having to get, I'm interested. I just think the two are connected to your health, mentally and physically. And when you're stressed out, it's things like what you eat can affect how you feel and all that. So I think we all agree, you know, I mean, you know, and, you know, we've tried out different things, and people have come in. It's been really, really interesting. So, you know, I think as a team we work well. I mean, the other thing is Lou's really good at social media. I think we just kind of sometimes find that, like, I'm quite good at it on the kind of marketing, so salesy side, like trying to drag people in generally. So, you know, I think we work well as a team, and, you know, normally I commit when I say I'm going to come, I come, and I agree with you on that one, definitely. That's so, but trying to kind of, you get people enthusiastic at the beginning, but trying to get people kind of like buy in and do it regularly is probably been the hardest challenge. Anyway, that's my bit anyway.
Well, if we're talking about food, we could go over to Janet, because Janet came in laterally and she introduced us to the wonderful Fran, who came and did a brilliant class in how to preserve food, canning as it's called. I mean, us two North Americans here, we've heard of this before, but it's not to do with cans, it's to do with jars. And it was amazing. And I think really people, exercise and food can't beat it as a draw to people. They thought the rest of the stuff we did is pretty weird. I mean, we had sound bath, and we had another kind of exercise, gyrokinesis. She brought her own people and they used the room. So that's the other thing that people can think of. You can hire out your space to people who want to do workshops and that kind of thing. I hired it for my workshops as well. But yeah, Janet, talk about how you got involved and how you got Fran to come, because that was just amazing.
Okay, so my initial interest in the PHA was post first lockdown, returning to the UK, having been locked down abroad. And I just knew I needed to surround myself with people who I'd be able to talk to and explore ways of boosting health. So that was really my searching online and finding out about PHA. And then bit by bit, I discovered Good Health York. Do you know what I mean? Something will open up. If it's meant to be, it will be. It just needs us to be action minded and get out there and do stuff, not wait for everything to drop into your lap.
Yeah.
So that's all I can tell you about.
I was going to say on that, actually, because you're obviously in a different area now. You've been part of the York group, seen what they've done, and I think this piece around supporting each other in your local communities and in other local areas to help everybody grow and share resources and share learnings along the way is really valuable. And I know that Your Good Health, you've absolutely been doing that, haven't you, with other local groups? You've helped people that have been starting out. I know you've had, is it Haven Health as well, is another one that's
the one in Doncaster.
Yeah.
Well, not yet, Thorn, pardon me. And it would be good to interview them, because their situation is a bit different, and they've got a really dynamic group, and they do lots of excellent things, and it's very close to Selby. I mean, Selby isn't far from York. But yeah, so this is the lovely thing. I mean, there are so many, they've been bubbling around under the surface. They've been on Telegram groups chatting and talking about it, and now it feels like there's another surge of energy coming up. And Leah is about ready to spearhead another little branch of Your Good Health York in a different area. We're going to relocate near to here in Heslington, which is right next to Fulford. These are all little tiny parts of York, peripheral parts of York. They used to be separate villages, but now they're kind of merged. And so Leah's more or less in the center, which is really good. And we've got people on the other side of York who want to do stuff, but you know, slowly, I think it's the.
You see, I think a lot when you talked about before with people joining us, quite a few people said they would join us, and they said, "Well, when's it all going to happen?" I said, "Well, this is it. This is happening. You can't expect something just to come out of nowhere. You've got to put the groundwork in." I think that's what some people found. They said, "Well, we've been coming for a few weeks." I said, think back to the NHS. That took several decades, and people they only see the finished object. They don't realise that all the groundwork goes in.
And I think actually that stops a lot of people getting started, doesn't it? When
it's the people that make the groundwork. You can't turn up and hope it all happens. Well, I did a talk on Ayurveda, and also I'm a percussionist, so I showed people how to breathe. Because that came out as sort of more or less, and people said, "Oh, I'm amazed at how long you can hold your breath for like breathing." I said, "Oh, I was taught how to breathe. I used to play a flute." And at the time I was 13, it didn't make a lot of sense to me, but I was taught by professional musicians. And so I've still kept that. And I said, well, it's not that you can't hold your breath for 13 seconds. It's because I do it all the time. So, but showing people different ways of the same thing. I mean, everybody knows how to breathe, but breathing correctly. In fact, people ask me, not every day, but somebody asked me the other day, is this the correct way to? I said, well, there are several ways of breathing, but this will give you more energy. And I think that's what people need. They need to know enough about something without being rammed down the throat. And I think that's with the PHA. We like to do this, but we want to see something at the end of it. Well, you will if you put something in. But I think people are very loath to do something, even to their time. And then people didn't drop out; they came in and came out, sort of stuff. And if there was cake involved, well, the people would come back. I've had cake a few times.
Yeah. We tried to introduce people to alternative sources of sweetness as well. I brought in a whole bunch of different sweet sources of sweetness that were not sugar, and that was a source of amusement to people. But
like me taking my bag of apples to the Craft and Chatter, because there's so many plates of cake and biscuits, but I turn up with a packet of bananas and a packet of apples as my contribution. just let's get a bit of healthy stuff. I mean, the treats are gorgeous, but you know what I mean. You influence them in a subtle way.
And I completely agree with what you've just said. Definitely. But it's almost like assumed if you can have coffee or tea, you can have cake with it. And then you're thinking, God, that's just really not what you should be eating. A load of wheat and sugar is.
Well, and speaking to that, how have you found getting people in the local community interested in what you're doing? Is there anything that you found has worked better than other ways at all?
Well, it's really interesting because we had one lady who was the Cub Scout leader, one of the Cub Scout leaders, and she kept popping in to see what we were up to. She joined in the exercise classes. She had a cup of tea with us. She had, chats about things. And we kind of started to educate her about stuff that she hadn't been asking questions. I mean, this is the thing. There's a lot of people coming from different experiences of the past 3 years. And so again, we can't be going, do you know that this is going on? Because, people aren't, well, they're getting more ready for this because they're like, what? And then we go, yeah, well, there's explanations for this if you want to hear, but we're not really there to kind of, like you say, ram things down people's throats. We have to
gentle introductions.
gently.
Yeah.
And if you had this might work. And if you had, if you change, I would say to people, I drink 6 cups of coffee, not me, I would drink 6 cups of coffee. I said, well, maybe if you change one of those cups of coffee for a cup of water, oh, that's a good idea. So it's just literally planting a seed into somebody's mind, and then they come back. I've been doing this and I feel so much better. I've got all the energy. I said, and you're breathing differently. And it's that sort of thing. It's not that people don't know what they're doing. It's another way. I mean, I think somebody said to me, oh, it's like when we were growing up. I said, exactly. It's going back to the original, not the original, but when you were kids, you didn't do that. We didn't have a supermarket. We didn't have this. And it's just going back to where we were before. People don't think that. They just think everything's a rush and they don't have to slow down, or going for a walk near trees and things like that.
Well, I think what's worked, I mean, I agree that you get people come popping in if it seemed interested, but I think when we did the big food talks, well, we had external communities, like speakers from different specialist areas coming in. Like one was talking about soil and how and using copper wire and how you could grow stuff. And then we had like food waste and abundance and all that. So that worked well, I felt. And people seemed to be interested when you had experts from different areas that didn't overlap.
And we can repeat those things. Just because we've done it once doesn't mean we can't do it again. We think because we've done it, maybe, okay, maybe we need to do something different. But I think having a repeat, because different people will come each time. And again, it's hard picking a day. I mean, we found it tricky, and we kind of canvassed amongst the core team what's a good day. And we settled on Friday because it seemed to be good for a few people, and then their lives changed. And so, we have to take account of that kind of thing. And Lynn's comment here, she was saying, well, she felt that a lot of people were promising to do some fundraising, and then that didn't happen for various different reasons. So, we have to be patient. Again, it's always about, for me, it's being patient. But she said a very key thing, she said here, we so much need others to join in and be aware consciously of who they are doing it for. And I think that's a key thing. It's about service to the community.
Absolutely.
I think that's the forefront of what we're doing. People might see it as an opportunity to further their own business, which it can do, because I got some people coming in for individual treatments because I was near to their houses and they didn't want to traipse all the way over to my clinic. So, it was handy for that in that way. And other people could have done that, but they were already busy doing other things. So I think we can rethink that going forward. And she says it's really crucial that people have a friendly, welcoming experience when they first come in, and not feel that they're coming into a group of people sitting, chatting, who already know each other. Because once we've been there a while, that did start to kind of happen. So we consciously tried to make an effort, but Lynn wasn't there. So she only came in a few times towards the end. But yeah, she's saying that's really important. And she said, it's important to find the right place, but it's the right people too, she said.
We did have a couple of people who insisted that we hadn't made a cup of tea for them, but they'd been there a couple of times before. And we try to say, well, it's for everybody. It's not any one of us are going to make a cup of tea for you. It's actually, we've done that, but there's, we've showed them where the tea, and the people do that. But I think it's reluctant. If you join a group that's already there, you don't really know what the rules are. There are no rules, but that sort of idea. And I think the people did come around to it, but there's a lot of people who said, ask me now, how's that, what's it called? Oh, PHA, how's it all going? I said, well, come down and find out. And people, some do, some don't, but it's a choice they make for themselves.
And I think that really is a mindset shift as well, isn't it? It's a real mindset shift from kind of looking to somebody outside of yourself to lead you, as opposed to this self-leadership and working in a very much a collaborative way. Have you found that to be any challenges? Have people been looking to certain people to kind of take the reins and lead, and have you found it difficult trying to encourage others to sort of step into their own power?
Well, this has been a lifelong struggle for me, because I'm the kind of person who just leaps in and does stuff. And I realize that by doing that, I deprive other people of the opportunity to step forward. So I have to make sure that I'm making space for other people to
Oh,
come forward.
I'm going to contradict that. I mean, I know you can be, forward thinking, but you always open up ideas to me. So I think the key, and I think it's not true what you've said, because I mean, I think we'd always sit down and say as a group what ideas we can do, and then we try different things. I don't know if Lou would agree with that, but I remember that I thought it was great fun, and we were trying to be creative and think of ideas of different things we thought that might be interesting to people. When looked at it, we tried different things, didn't we? So I would say, I think you're good in terms of trying to push. So it's important that whoever's leading it does lead it with an open mind. And, I don't think that was an issue in our group. Anyway, that's how I feel. I kind of
I
felt
think
Maybe I've learned.
collaborative, I felt.
Maybe
Yeah.
I've learned.
Yeah. I don't know. Lou, do you agree, Lou?
Yeah, I agree. I think the thing with June is like she's so good at just cracking on and getting stuff done that needs to be done, like all the paperwork. I mean, like she said, she's had to do it all for the clinic anyway. So she's got the expertise in that area. So she just cracked on and did stuff. I wasn't able to commit as much time. I was working sort of 32 hours a week in a corporate job. So, I didn't have the capacity. So it was great that June was the one that just cracked on and got stuff done. But then, like Leah's right, when there was some discussions to be had, everybody was included. So it's not like I didn't feel that June was sort of stepping up and saying, I'm the leader, you've got to do it my way. There was none of that. It was she was just cracking on and doing the practical stuff and then involving us all in the decision making. So I thought it was a really good balance.
And because
Yeah.
of where I live like it was quite a distance. I could have gone by taxi. I did do that a couple of times, but then when Louise joined, she was coming practically past my house, so I could go then, because it was not en route, but it was en route in a way. She made it en route, so I went in with Louise, and again, it's difficult to pick a place that suits everybody. You can't have that. If you're going to have that, then it would probably be central and into town. That we didn't want that. We wanted things on the periphery, so you get more of the local villages coming to you, because then they'd know. And I've seen people who've been to other things and things that I've run, and they say, "Oh, I remember you." I said, "Hey, wasn't it such as?" And then it brings another conversation strange to it. So it is. York is a very strange place to be. When I moved here, it's like very different to anywhere else I've lived. But you mix with the people that you mix with, and you become known to that group. And people say, "Oh, I know you. You're everywhere." Well, not really. But then your name gets down, or you do certain things, and you go to another group, and you find that 15 people there already. But that's York, because it's got like a village mentality in respect.
And I think that kind of the collaboration piece and what's already out there is another thing, not reinventing the wheel, so to speak.
Yeah, that's what
And
Janet was saying. It means otherwise, if you do all that work again, it's not only repetition, but it's the energy used, and then people won't feel valued. If you use somebody else or with somebody else's ideas, they will get to get something out of it, which they probably, because lots of people think they're on their own, because they're not. But if they don't know of any other groups, it becomes a very difficult concept to put across. But if you know somebody else who can collaborate, people are willing to collaborate, but they have to know about it. It has to be something that's evolved in a way, because it's mostly evolved from scratch, really, isn't it?
yeah.
Yes, well, exactly. We were doing stuff that never been done before. This is the key thing to remember. There are kind of templates now, but we don't want to be cookie cutter, do we? We need to allow this to be organic and come from the actual people who are in each vicinity. And the countryside ones are going to be very different than the city ones. And now Lou and Leah Lou drove a long way to come every Friday. She was the most committed person I know. But now, something can happen over their direction eventually when it's time, and she's got that experience and she knows how to do it if there's more people around her. And we've got a bunch of people. I've got 1, 2, 3, 4, 5, 6 people I've written to today to suggest that they go and talk to Leah about doing stuff in their neighborhood, because they never quite made it to our place because it was too far. See, you talk about London being a bunch of villages. Well, York is a bunch of villages. People don't necessarily drive across town. Lou is very, very special.
Tribal still.
Yep, yep.
Well, Janet, I know you're looking at setting something up in Selby, as you mentioned, and so how kind of what's been going on in York and what you've seen, how has that sort of helped you form a vision for how you want to get started in Selby,
Well,
and who you want to
yeah.
connect with?
No, to be honest, it was for me, it was very, very much an eye-opener and phenomenally encouraging. I mean, I've got to say, June shared all the paperwork and what have you. She emailed it across and what have you. And I'm not like I said, my big thing is don't reinvent the wheel. Tweak it, make it localized, make it relevant to your area, but don't expect one size to fit all. And I think even with the paperwork, I realized that this is great, because the one thing I don't want to do anymore is be forever devising, which I did in a previous job, policies and protocols. So to have them handed, which I can just tweak around, was fantastic. So that was brilliant. And to look at the Scout Hut and look at the expectations of the different complementary therapists idea, and the sharing of information, kind of this idea of having this folder full of people's, just there on a table, just a folder full of people's therapists, and the rest of it contact details or business cards or little A5 sheets. I thought, that is such a great idea, because you can't remember and you can't be always looking at your phone to recommend somebody, and what suits you might not suit somebody else. So that kind of resource element of how to bring something like that in was fantastic. I am by nature somebody who prefers facilitation than leadership, because I just know I'm 70 now, but I know from all my years at work and doing voluntary work from being about 20, I know that more comes from the group think than comes from somebody having great ideas. And I have been conscious of that for Selva, because I'm the only person at the moment, and Sarah, who I've not really made much contact with, because I know she's working very, very hard with her family and her business, and her husband works full-time and all the rest of it. But I will be liaising more with Sarah as really a sounding board, because she's made it very plain she's very little time to contribute. But if I've got somebody local with her skills who is great at listening, and I can just say, look, can I have 15 minutes to sound off at you? And I'm sure June would do the same in the York group, and I know others would do. So I don't feel lonely. I just feel I need to once I get this room sorted, then I already know people. And I've been thinking, I'm thinking of this networking being things like, I don't know how, if any of you have heard of University of the Third Age, but they're always asking, do you want to do an odd workshop on here, an odd workshop on there? Because they know things I've been involved in. And I've always said no. I've always said no, because I don't want to spread myself too thin. But equally, I'm thinking of groups like that, or parent-teacher associations at your local school. They're feeder groups. There's so many feeder. I just look at, we can each feed the information and what we're about via lots of different ways. It's just, we could feed Selby, whatever it will end up called, but call it PHA for now, could end up feeding people into the mental health groups that exist in Selby, or the food bank volunteers. If somebody's kind of feeling isolated and lonely, sometimes going volunteering is a great thing for them to meet others. I just see it as one big opportunity to link people together with information which may help their health and well-being in the biggest sense of those words, really.
I mean,
Yeah.
even if you didn't do it once a month, you could do it once every 3 or something. So you could do it with the seasons. So maybe that,
Yeah, there's lots of ideas I've got. Honestly, I think I completely agree that there'll be a I mean, I don't want to take the stage here to talk too long, but I think there's a lot of ways of doing things. I think we just need to be creative. It's like, I know the room I'm thinking of, I know from other things that a weekly hub would probably capture more people than them having to worry, have they got the right date in the diary? I mean, I go to 3 things: local history group, Dark Skies, which is about astronomy, and a backgammon group that's just started up recently. They're once a month. And I have to keep thinking, now this Thursday afternoon, is it backgammon or is it local history? You know, one's on the first week, second week, and a 4th week. And it's like, hang on, there's 5 weeks in this month. So is it the 4th week or is it the last week of the month? You know, there's all these things which are confusing, aren't they? So, but the group itself will dictate. I'm sure this collaboration, I'm massively for collaboration. And I mean, I already know 2 or 3 people who haven't a clue what really it's all about yet, but they're so keen to come and make the cups of tea or do things. I know you're saying in your group, people need to get on and make their own cups of tea after they've been welcomed and know that this is what the plan is. But there's 1 or 2 people I know who are just, their act of service is making.
Well, everybody's different individual. That'd be great. So and then everybody has what, maybe half a dozen friends or even 5 friends. So if each person tells 5 friends, that's quite a lot of people.
Yeah, well, there's 40 people regularly turn up at the Craft and Chatter at the same room. And some of them live very local to that estate where this venue is. And I know some live in Wakefield and travel in because they just think it's a great group. But nevertheless, I see, for instance, the Craft and Chatter becoming, even if it's only 2 or 3 people who I know have got health needs. And I'm always being asked to give advice on one thing or another with health. It's like, please just remember, I've retired 15 years. I'm not up to scratch, but I will look it up. I'll come with you to the doctor and ask relevant questions. Or, you know, I've done so much advocacy with people at GPs and in hospital. I began to wonder, would I have any time for PHA? Because everybody just seems to want you to trot off to the doctors or the hospital with them to make sure they're not overwhelmed. There's lots of ideas of what you can do with PHA.
Yeah,
That's
can I just make
That's
a
something we
comment?
could offer, couldn't we? I didn't even think about that, offering to go with people to the doctor.
Oh, they'd love
That's
it.
a brilliant idea.
Especially, says she, because that's the group I'm mixing with more, the older people's group, who are definitely the dominant group at the Craft and Chatter I'm part of. Yeah.
Sorry, Leah, but you could say something.
Leah wanted to.
Yeah. Well, the only thing I would say, because I think we threw a lot of ideas when I joined the group and we tried out different things. And I think if you're trying to kind of like be the kitchen sink, it doesn't seem to work, at least with our area it didn't. So I think trying to find out what your group is, you know, and what their needs are, and then focus on
Starting on that.
they need. I think if you're trying to do too many things, it gets complicated. And
I wasn't saying we need to jump in and do that right away, but it's just something to put on.
Being an advocate is a really useful thing, because people don't always know who to ask. They might want to, they maybe want to ask their own family. I know when I've been to the doctors with my mum, she's since left the planet, but not because of that. But but going with somebody as an advocate, because you're not afraid, you're not connected, so you can ask all sorts of questions.
But I also think that kind of piece around a sort of signposting service as well, so that people can find therapists or health information via one kind of route, rather than trying to talk to loads of different people.
Absolutely. So it's all about what people want, because that's what it's about for the people. So if people don't have those things to put forward, that you could have a list and say, what do you because not everybody wants to say what they want out of it. But if you have a list or an idea, or somebody else has an idea, you can feed through on that. And as Janet says, she's got somebody to do that. It puts thoughts in people's minds, and if they can run with it, or they don't need to. It's not a either or, and it's not something that has to be done on a regular basis.
Yeah,
I like the idea that I noticed happened at York when we had taster sessions. That's how I sold it to my friend, who I knew would really benefit from when Louise did the TRE trauma release exercise sessions. I got a particular friend I knew really would benefit from light physical activity, and she wouldn't have been happy sitting and just talking for hours about her problems and her stresses and stuff. But she really benefited from that, and the idea of short-term taster sessions, or even a one-off taster session, maybe from the people who you've put the business cards in your contact folder. So will you just do as a one-off half an hour or an hour's session?
Yeah.
I just think it was what went on at York really helped me to see the possibilities.
Yeah.
So kind of where you've been then in terms of the journey for the last 3 years, and what you've learned, how do you see things evolving now? Because you're not in the Scout hut anymore. What's sort of the next step for you, and how have you kind of come to where you're at with it based on your experiences so far?
Well, we've got to get some more money. First thing, before we do anything else, we've got to get some more money behind us and some regular money coming in. So that's where we have to revamp the membership form. You know, so that's it's been a collaborative thing. Yeah, I cracked on and wrote things, but then I always try and get other people's opinions, and we have had several versions of different documents, and again we have to revise as we go along. Skill sharing, we want to do, don't we, Leah? We talked about this, getting older, like the U3A, getting older people in who have skills, particularly mending things, making things, younger people coming in and learning from the older people, and also teaching the older people, because they've got skills that the older people maybe don't have in regards, technology, but trying to keep the tech out of it as much as possible, really, because we need to kind of be real with people. So I think that is, and we've been approached, well, somebody's suggested that there be a repair cafe in this location where we haven't even started negotiations yet. We've lost Janet. She's vanished.
Don't worry, if she comes back in, I'll let her in.
Fallen off the radar. Yeah, so yes, repair cafe.
And the other thing is when we had a local student from the university who's doing a counseling course. So kind of offering the mentoring so they get hands-on experience. It's a good way to drag in one of, in other words, we were trying to get him to promote some of his fellow students to come in to the hub. So I think it's, the skills sharing, but also mentoring. So, and he seemed to get quite a lot from it and get quite a lot. So it's quite nice because, our target group was mainly the older people, but then it's kind of nice to see a young person in the group that would welcome whoever came in. So I think that was one of the things I was going to say. I don't know if she's still there, but I was going to
around. He's still around. Yeah.
Oh no, I meant whether or not Janet was still there. But I mean, I kind of feel that one thing is trying to kind of think how you can engage with the different people who live in the surrounding area. So and reach out to those opportunities. And I'd say that's something that we would continue doing. I mean, I'm not, even if I set up a hub locally, it doesn't mean that I wouldn't go and help out June. So it's back to what Janet was saying. I think it's kind of nice to go and visit the other hubs, which is something that she's mentioned, which maybe I haven't done because I joined the group later. I would like to do that. I think you can learn from other hubs.
Well, we were talking, weren't we, Amanda, about having a regional hub get together with Mel and her people in Leeds. I mean, there's a hub in Wakefield, there's one in Huddersfield, there's the Thorn one, there's the North Yorkshire one, there's York people, there's Wetherby. Is there one in Wetherby? I think possibly, so. and then Leeds. I mean, Yorkshire's full of people doing good stuff, isn't it? It's just so exciting. Yeah.
So for thought, though, I mean, why not have an event, kind of like a workshop-y event, where we all come together and talk about what's worked and what the challenges are and how to move it forward. I would welcome that myself. I don't know if you've done anything like that elsewhere in the UK, but I don't know if Lou would agree with this, but I would. Yeah. If I was around,
I think there's definitely I think people are coming to the same conclusions. I know in the southwest you've got a few sort of dotted around Taunton, Glastonbury, so I saw Somerset area, and definitely sharing the learnings is absolutely key in what we're doing. What would you say then have been your biggest challenges given what we've been talking about? Lou, have you got any thoughts on that?
Finances, yeah, getting money in, getting people through the door, getting commitment. Yeah, all of those.
I completely agree.
Absolutely. Nothing else to add to that. That's it. You summed it up.
I mean,
How have you got people through the door? Because you obviously did have a weekly clinic for a year. What did you find was the sort of the best way to get engagement from people?
Well, June was direct messaging individuals that she knew.
yeah,
I did. And we also,
And word of mouth, the people that came in, they said, oh, my friend came here, that's one or two, but even one person, it's not about the quantity, it's the quality. So even if one person turns up because they've heard about it, that's the word's getting out there, isn't it? You know.
we also had the local area coordinator who is still very much, well, we've several, and they are employed by the council, as they call it, to walk alongside people. And it's really worth seeing if your local council has got them, because they're funded by government money, central government money. So of course it could disappear any minute. But they're doing such a load of good work. They're really lovely people. And she's been so supportive. Every time we post anything, she reposts it on social media. We haven't got a Facebook page because I wasn't willing to try and manage that as well as all the other things. But we've got Telegram and
Signal.
Instagram.
Yeah, Signal.
Yeah, no, but for the public.
Oh, yeah.
For the public, and we haven't got a website, and I think we probably could do with a website. Mel has got a really nice designer who's designed them a beautiful website, but they'll need paying, won't they? So this is the other thing.
Yeah, funds. Well, finally, I mean, because I think there's some brilliant nuggets of information and wisdom that's come out of this. Have you got any advice for anyone who's just started to learn about PHA or just starting to think about building something in their area? What would you recommend is kind of a really good, just basic first starting point?
I've got one starting point. Janet mentioned this. Find out what everybody else is already doing. Don't reinvent the wheel. So that's the first thing I'd say. Like, connect and talk to people and network. That's my
Talk to as many people that you know and ask them their ideas, not just particularly we're doing this, but say, what would you do? What would you want? Because everybody likes to be asked and likes to feel the importance of being asked. And I think they would have ideas, because a lot of people don't get heard. However, they don't get approached to be asked, oh, what are you asking me? And they'll not make them feel important things, but they would know. Loads of people know things, but we don't know about those people, because unless they mention it to us, we can open up the ground and sort of say, this is what what would you like out of this if you were running one near you.
Yeah, and that I did do that. I went round to various food cafes, the pay as you feel cafes and things like that. And I just had a little stall there, and I just asked people who were there, what would you like to see in a health hub if there was one? And they went, what? You're asking me?
Yeah, exactly.
Yeah, that, what? Woo.
Yeah, and I think that's really valuable advice. Oh, well, thank you all so much. It's been absolutely brilliant hearing from you, and we'll put description of where people can find you in the YouTube description. And if you've got any other information, I know you've done a fantastic amount of policy documents that you're always happy to share with people. So if anyone is interested in seeing those, would like to use those for their own hub, or at least kind of take a template that they can start working with, then I'll put an email address in the description as well for people to get in contact with about that. But thank you all so much. It was lovely to have you on our community conversations.
Thank you.
Thanks so much.